You're listening to the Human Under Scrubs, your one stop destination for uncovering the human side of doctors. Join us as we dive into personal stories, opinions, and experiences that go beyond the stethoscope, revealing the people behind the invisibility cloak, the medical scrub.
Welcome to today's episode. We're honored to introduce Dr. Narendra Vaidya, with a gold medalist and university topper with over 25 years of experience, widely regarded as one of the best robotic knee replacement surgeons in Pune. Dr. Vaidya's expertise includes primary, complex, and revision knee and hip replacements, as well as minimally invasive surgeries. His dedication to advancing medical science has earned him prestigious awards, including the Rashtriya Ratna Award, which he was awarded at a very young age, the Indian Leadership Award for Healthcare Excellence, and a spot amongst the 100 most impactful healthcare leaders. With the leading orthopedic department at Lokmanya hospitals, Dr. Vaidya oversees state of the art facilities across Pune, Kolhapur, and Western Maharashtra, making world class orthopedic care accessible to many. Join us as we explore his journey, expertise, and the groundbreaking work he's been doing in the field of joint replacement surgery.
So, starting off, where were you brought up as a kid? Is there any specific place that gives you the pure nostalgia effect? It can be a place, a thing, or some kind of food as well.
See, I'm a typical Puneite. I was born in Pune, brought up in Pune, and my parents they have my father comes from a very small village called Kurunduad, which is a very small village near Kolhapur. So even if we are brought up in Pune, the culture in house is of Kolhapur, which is a
Oh.
small town which has its own typical flavor
Hmm.
actually. And so we are not typical Puneites, even if we are residing in Pune.
Right.
So it's an interesting mixture at home. So the food habits and everything also differs slightly from a typical Puneite.
Hmm.
So my father is a surgeon, and so the from childhood there has been a medical background as such. Education also was in Pune. I was educated in modern high school in a typical Marathi medium school, and to tell you that I was very good academically in school, also always a topper and all things like that.
Hmm.
Always used to be amongst the rank holders, you know. And to tell you, I being in Marathi medium, we were taught ABCD in fifth standard. So
Oh.
I did not know ABCD till I was in fifth standard. So it was all Marathi.
Hmm.
And that time they used to conduct a lot of the competitive exam. One university called Tilak Maharashtra Vidyapit used to conduct competitive exam for all the kids.
Right.
And I remember being in toppers in all those exams, and the only exam where I passed in third class was a spoken English exam.
Oh.
And I remember that was a third class, and now it just doesn't make any difference. I would like to tell my young friends that it just doesn't make a friend, because I used to be so much awkward speaking in English, and today now I am a speaker at international level. I can speak English, and we get complex being in Marathi medium schools and things like that.
Hmm.
But it just doesn't make any difference. And school, it was fun. Our school was a great mixture of boys from all strata of society.
Hmm.
We had a police lane just next across to our school, and kids from children of industrialists, doctors, and engineers, villagers. They were all there. And I remember we playing what used to be called a chappal cricket. So there were no bats, and there were no equipments. So people used to have a chappal in the hand, and
Huh.
then we used to have a peculiar ball which people used to make from wet paper. And then we used to go to a cycle shop, and we used to get those fata tubes, and we used to make rings
Wrap
and
it.
make a rubber out of it and play cricket with that. So in the recess, we used to play cricket with that. So we started journey like that, and it was fun. And today, if we see our generation, they have really made India proud. All of us, there have been my classmates have been in NASA. My classmates have been great doctors. They have been entrepreneurs. They have been industrialists and whatnot. And really, that type of schools are now, there are so many schools which are modern schools and things like that. But from the schools, what we come, I think we really have made the country proud. And it's if the education is really given in an open environment, I feel that it really gives the children opportunity to express themselves and to go ahead in their life. So there were no restrictions. The teacher used to scold us. They used to at times beat us, whatever. It was not good, but
Yes.
it was quite open, and I think we have made quite we have come up quite well out
Right.
of it.
Right.
And there was, even the sports culture also was quite good. So many of us became quite good sportsmen. Like, talking of myself, I have played national tennis. I have a national tennis player, and I was a university captain as a team captain of the University of Pune also. So it was like a 360-degree development during childhood. And I have a lot of moments to cherish during my childhood.
So lawn tennis was famous as a sport then?
Not really. People did not know about tennis.
Oh.
And I used to stay on Deccan Gymkhana, so it is one of the very few clubs, across the country that time which had tennis courts. And it used to host even Davis Cup matches or Masters matches. And there was one very famous coach that time, and there was icon or Mr. Nandan Bar, who was a national tennis champion. So many of us being kids looked at him and wanted to be something like that, and we chose tennis as our sports. So at one time, all the titles, right from under 10 to men's, were all with Deccan Gymkhana. So we all used to love and played tennis. Unfortunately, what happened, two things happened around when I was 13, 14 years old. One, I decided to become a doctor, and my studies increased, and so my time to tennis reduced. That time I was a title holder for under 12 national champion in doubles, and runner up in singles, and state champion for tennis in singles. And the second thing, which was beyond my control, was that my height stopped growing. So then, in tennis, your reach is very important. So both ways, it was not possible for me to pursue a career as a sportsman. So I still play tennis as a leisure sports, and still my son cannot beat me. I am a very fierce competitor. I do a lot of sledging also. I don't like to lose, and definitely I love it. I follow tennis a lot, and
Do you have like a favorite player?
yeah. I have favorite player. Federer is my favorite player of this generation, but I like Djokovic equally well, just for his tenacity, his perseverance. And I was cheering him last week during Olympics. Yes.
Yeah.
And the way he has come from injuries, and the way he has proven himself over the period, he may not be having the greatest strokes, but the way he is persistent, and he is great. Yeah.
So this it's great memories from your town. Have you got a chance to like visit again recently? Or
Like your school, have you got
Yeah, I have visited Modern High School as well as Garware High School. I was in Garware College, so I do visit quite frequently.
But as a chief guest, like
Not officially. I like to go alone. I visit there on Sundays when it's just like that. Like to spend time quietly and go to my bench and sit there sometime. I was called to my classes as a guest of honor sometimes, and give speech to the students. But I have done that couple of times. But more than that, I like to spend time myself. I've taken my children sometimes and gone to my school. And, taken them there and shown them around and told them what things one shouldn't have done, not what one should do.
Yeah.
But I have told them what one should not do, and told them what all the mischiefs we used to do. And if compared to me, they are very good boys. I was quite mischievous, and did a lot of things which I cannot tell right now.
Right. But you were still well rounded, always top school, so mischievous is fine.
Yeah, actually, academics was good, but at the same time, I think I had the other side also.
Okay.
It is there in me.
So, if you have any recollection of it, like if, usually as kids, you get asked, like, what do you want to be when you grow up? And typically it's either cricketer or astronaut. So, for you, was it, say, tennis, being a tennis player?
Tennis was always dear to me, and I wanted to become a tennis player. But as I told you,
Yeah.
it was not like that. But I always wanted to become a surgeon.
Okay.
My father was a surgeon, and that
Right.
time medical rules were not that stringent. So, as I recollect, I think I must have been in fourth or fifth standard when
Oh,
I went to the operation theater first time.
right.
And my father was a general surgeon, and he is a general surgeon now. He
Hmm.
is retired.
Hmm.
But I saw the abdominal surgery first time when I must have been 8 or 9 years old,
Right.
or 10 years old, maybe. I saw the intestines, and then one scrubbed also when I was very young, and
Hmm.
felt the intestines. And
Hmm.
since that time, I have been always wanting to, be a surgeon.
Hmm.
And he since that time, my mind has always been that I want to become a surgeon. That means there was no second thought.
Right.
And in recent, there was one award ceremony. I don't remember when it was not a medical award ceremony. Actually, it was something different when I was called as because I have promoted a organization. Surgeon is one aspect of my life, but I am a promoter of Lokmanya Hospitals Private Limited, and I am sort of a medical entrepreneur also.
Right.
And I have floated a company and grown it also from zero to what level it is today.
Right.
And I was asked to give a talk on what are the difficulties in these things in all this journey.
Hmm.
So in that particular aspect, I was telling them about all these things that there are many. You have to be multifaceted
Right.
in these things.
Hmm.
um I mean, you growing up, like you mentioned, like playing chappal cricket and that sort of childhood, and
Yeah.
the kind of children the lives that they lead now, you like seeing your own children with them. What changes have you prominently noticed?
I think
Things that
today's kids and schools and education is too disciplined, and they go on a very single track sort of a thing. Whereas for us, there was no rule book as such.
Hmm.
There was no rule book. You had to study. You have to do your whatever things were there, and there were broad rules. Broad rules like you shouldn't lie. You shouldn't lie. If I remember being punished only once by my mother because I lied, and till date I try to not to lie. And another punishment which I always used to get was only from my drawing teacher, because my drawing was really horrible. So otherwise, I was very favorite of all my teachers, but drawing was bad. So he used to always ask me to come and draw something on the board, and well, it used to come out something. Some animal he used to ask me, and the animal which used to come was not animal, it was tree maybe. So he was only two instances like that. But today, I think when I look at my kids, they were very disciplined. There were hardly any bad words in their mouth, whereas we had many in mind during our childhood, during our college days. Probably there were a lot of bad words. Sometimes even today there can be bad words in my mouth. But, these guys are quite well mannered, very well disciplined. Another thing which I noticed is that during my school days, talking with a girl was something like a sin. We had no boys high school and girls high school were different.
Yeah.
So लड़की के साथ बात करना means something you have done some big sin. So or something extraordinary thing. So that is gone. I think that's a good thing.
Yeah.
There was no education as such during that period. Means I was in school. Um, I passed my 10th in '83, so that's the period. So I think that's a good thing which has happened. The openness of communication between boys and girls. That is a good thing in schools that has happened today. They have been open, they have been talking to each other, and that openness in schools is a very good, welcome thing, I think. Gender education, sex education,
Right.
those things are good things which have happened in education system today. I think that was not there. So many times we used to learn about these things in a wrong way. Wrong things were told to us during our school days
Right.
when we were entering, when we are say 8th standard or 9th standard, about sex education. Many times wrong things were told to us. You know, there are a lot of miscommunications, wrong things, and bad things told to us, and so there was no way to learn correct things. There was no internet. There were no good books. There were no chapters in the textbooks about it.
Yeah.
So that aspect has improved a lot, I think, and that's a vital part of education, I think. And that has improved a lot.
Oh, you mentioned your classmates being in NASA, entrepreneurs. Oh,
Cops
you?
also.
Oh, okay.
Yeah.
You can you name any like of your best friends and like some fond memories that you have with them, just to refresh them?
Yeah. Now one of my good friend Vivid Thorat, he went to US and he is now Homeland Security Chief there now.
Oh, okay.
So actually he's an engineer, and then he went there. Then one of my friend Sachin Sani, he went in NASA. Then sorry, Fadke, he went in NASA, and then one of them went to US Air Force. Then so a lot of them. Then one of my batchmates in BJ Medical College, he after completing his MBBS, he went into IIT. He became MTech, and he went into biotechnology. So a lot of them went into various fields, and one of them now, Dr. Sunil Vartak. He's an Everest climber, actually.
Oh, okay.
So there are people who have achieved in different fields. So I think a lot of them.
So any special childhood stories with them, like that you like remember, like
Yeah.
from school?
Yeah, from school, colleges, a lot of stories like this. Sunil Vartak, he was a trekker right from beginning. So he used to always take us to trekking, and his rules were very difficult too. So he used to give us targets that you have to walk up to this point, and nobody should drink water. All those things. We were casual trekkers, so very difficult to follow his rules. But very fond memories with them.
So you as a child and you now as a surgeon adult, what prominent things do you think have changed with regards to your behavior, character?
I think I am still a child at mine, and that's very important, because even if you are doing a very serious and a very what do you say, a very complicated surgery, you need to be young at mind, and you need to keep on joking. My operation theater is never serious. People have attended, and my students are, and my fellows and my PG students, they are extremely at a jovial mood, and they are laughing. And at the same time, they are learning a lot. So I think by heart, I'm still very young, and my child in me is still very much active.
That's
And definitely, one needs to be like that.
yes.
You have to be like that. If you are serious and you start telling, see, boss, you have to open the knee joint like this, and now cut from here to here. It's not like that.
Yeah.
They would probably end up
So-
making more mistakes.
Yeah, I mean, you can tell the same thing very easily and casually, and you can make, it is better to make a surgeon by taking away fear from his mind rather than creating fear in his mind. And that's the philosophy in teaching and creating a surgeon. And now I have got more than 200 surgeon students whom I have trained now, and they are right from, you can see them spread all across India. Presently, 25 students are there from who are my fellows, who have done their masters in surgery and who are doing fellowship in joint replacement under me. And they come from all over India. Presently, I've got international fellows also from other countries. They come from Singapore. They come from, now presently I've got from Africa. I've got from Malaysia also. So they come from various countries also, and they like this approach also. So there are theoretical lectures, but it's always better to be, light mood and light hearted. So don't miss the point.
Right.
But at the same time, you can tell it in a very light mood.
Absolutely.
So while we were researching about you, we came to know that you were very close to your grandmother. So do
She
you
has treated me. Yes, yes.
so do you have any special, story or life lesson that she taught you that makes you the person that you are now?
See, yeah, absolutely. Means she and me always, first of all, whatever I am today, I think two people I must say. One is, of course, my father, who inspired me to become a surgeon. But as a person, I think what I am is thanks to my grandmother. And she was a very simple village lady. And she always used to be, in my house, she used to sleep with me. Means we used to share a room. And right from waking me up in the morning. So my study method was very weird. This thing, like I used to sleep at 9 o'clock, and I used to get up at 1 o'clock in the morning.
Oh.
And she used to wake me up 1 o'clock. So she used to call me, Naren, Naren, hey Naren, get up. In Marathi, Naren, ut. So even if I am awake and I am with the lamp, her alarm, Naren, hey Naren, used to go up continuously. Arey, Aji, I am awake, I am awake, I am studying. So she used to do like that. So once it happened, a very funny story I'll share. And we had this dissection of frog in 12th standard. So we got as a rehearsal, or you can say to our final exam to 12th standard. That time we got a frog in my house, and three of our friends, we got a tray from my father's hospital, and we had a frog pit to the and anesthetized with the ether. And started dissecting its intestinal system. And somewhere our anesthesia went wrong, and the frog got he got out of anesthesia, and he got up, and it started jumping all around the place around there. And we got so much afraid that we jumped on the cot and we jumped on the table. So my grandmother, who used to wear that old style Nawari sari, she got hold of it, and again anesthetized it, and did everything. She was not even 10th pass, but she was calm and quiet. And so these are the qualities which you cannot write down. These are not qualifications. So she was very calm, quiet, and very much this thing. So she, don't be afraid. We'll anesthetize it again. So it is like a surgeon, who gets into a trouble but remains calm and quiet and comes out of crisis. It's a big quality of a surgeon. So the small incidents taught me that don't get panicky. You can come out of it. So there are many incidences like that that we used to learn from small things like that. So from my grandmother. So she was always an inspiration. Uh, you know, she never told me that you should behave like this. But every action, every small action, whatever she used to do, was always a lesson to us. I cannot tell you that, she taught me this, she taught me this, but everything what she did always was a lesson to us. So she used to tell us very simple stories, say from Mahabharata, or say from this thing. She told us about Lord Krishna. She told us that today, if you see and if you tell me, then what she told, I can tell you how the Lord Sri Krishna was the best CEO. I can make a presentation. But that is how she told me in her language that time. That is about 40 years back, when I must have been 12, 13 years old. See how he managed this thing without taking a weapon in his hand. How he managed Arjuna. How he managed this situation. See how he managed this. So this is a management lesson. But that simple lady told me how Sri Krishna was a great manager, or how he was a great CEO. I have not learned management formally, but I learned that management from my grandmother. And she used to tell me like that, from old stories like that. So like that, she was my great teacher. Very interesting ways of teaching. That may not be possible by going to IIM maybe,
Yeah.
but that is how she used to teach.
Right.
And you have to grasp also. So a lot of things are there.
Correct. So with this, we'll start the next segment, Young, Dumb, and Broke. So this is after, say, since your high school education until you became a medical graduate. Yeah.
Yeah.
So the overall our education system. So the way it used to be, do you think and now, do you think it's on par with the like the Western world, and how what opinion overall do you have regarding the education system?
Very honestly, I think I have no experience about the high school education in US or anything like that, because I have never been educated myself in US as far as high school education is concerned. But when I compare, say, surgical skills, surgical education, I think Indian surgeons and today's medicos are better in India than any part in the world. 100% sure, no doubts about it. 100%, because the kind of exposure what we are getting, practical exposure, the kind of patient what we see, like for example, take example of my specialty, that is knee replacement. Those guys don't see the complex cases now. Like in US, they see really primary cases. They don't see the kind of deformities what we see. Or for example, say infectious diseases, what we see in India, what resistant bacteria our physicians see, those people are just not exposed to those kind of complex situations. Take example of COVID pandemic. Our country being so densely populated, our country having so less hygienic situations, had least mortality. We tackled the situation much better. So medical overall, you see skill levels of doctors, nurses, I think we are much better than that. I have no doubt about it. People may have doubt. Today in India, our people, I really don't know why celebrities go outside and get their surgeries done. And then probably the main reason behind it is privacy. But otherwise, medically, we are better than them. There is no doubt about it.
In fact,
And
medical tourism has been
yeah, medical tourism definitely, cost is one factor out of it, but skill level is it's definitely the most important factor out.
Yes.
Medical education has been really great. The methods of teaching are different in US or in Europe. They are different, but I think in India we are more practically oriented, and those people are going on mannequins and things like that. But as far as practical knowledge is concerned, and especially the postgraduate medical education is concerned, I think our guys are much better. And definitely, if we compare post master's degree, 5 years down the line, the kind of experience our guys they have is much better than the contemporaries in US or Europe or any part in the world. Definitely. Where we lack is documentation. We don't have time. We don't have systems where we don't publish our research papers as commonly as the Westerners, and that's why we are not recognized in the world. Like for example, take today's example. I have done 28 replacements today, but I don't have time today to write my papers. I don't have time to sit on a computer and write my papers, write my findings and this thing, because of sheer load what I have today. Now 28 replacements in a day, probably a US surgeon will be doing that in a month.
Yeah.
Okay, so it is unheard of. It's impossible. So we do it in a systematic manner. Proper. Our working pattern is so systematic, and this is so many US or European surgeons have visited my center, Lokmanya, and they have seen that this is happening.
Yeah.
Every day it is happening, and there are many centers like that in India who are doing this kind of volume surgeries. It's not the only center. There are other centers also. So we are much, much more oriented, systematic. But the problem is that we are not publishing our work. And that's where I think we are, behind them. So we have to blow our own trumpet. We have to publish our data. And it's not only about orthopedics in many fields. The quality of data, what we are publishing, has to go up. Probably the next generation who is now getting educated is getting more oriented. They are more computer savvy. They are more technology oriented. And I think I look at my children who are also doctors now, and one of them is in medical school now. So I think they are better than my generation in documentation, and they are probably will be in a better position. My fellows are better than me in documentation. So probably in coming decade we'll see a lot of papers coming out from India, and we will be teaching the world definitely. Secondly, I think we are also now taking part into development of we were always following the Westerners in developing technologies. Right. We used to always say, for example, knee implants are better if you use an American implant. But today now there are companies in India where doctors from India are helping Indian companies to develop implants which are better than American implants. So this is the way. So ultimately, I see the next decade is going to belong to Indian, definitely surgeons because of their experience and because of the technology, because of industry, medical industry, which is growing in India. And so this collaboration is going to be great. And definitely both the treatment as well as the production cost is going to be optimum. And both this combination is going to be great. And that is going to be the world's production is going to move here. As far as surgeries also will come here, and the production of implants also is going to be the hub. India is going to be the leader.
But so talking about the issue of documentation, if I may call it research, so is the issue only qualitative methods of us documenting, or is it also the fact that the ratio for us, like per surgeon to patients, is so high? Like how you said, you do 20.
It's high. And
So lack of time. How do we, tackle that issue?
I think there are two things which still I would like to elaborate. In India, still what happens is if you compare, say, for example, UK NHS and the system in India, still in India, it is more of a doctor or a person-oriented health system. Take example of any patient, for example, he wants to go to a particular doctor.
Correct.
Whereas in NHS or in other countries, he goes to a system.
Correct. Right.
If you are on duty, a patient has to see you.
Right. Right.
If she is on duty, he has to see.
Right.
If I am on duty, he has to see me.
Hmm.
So he goes to a system.
Hmm.
Whereas in India, he has to see you, he has
Yeah.
to see you.
Yeah.
Then doesn't matter if you have to do 20
Mm.
surgeries or 30 surgeries and you have to wait up to 11 o'clock in the night, he will wait for you.
Right.
That's the obstacle.
Mm.
So we will have to wait and see how we develop it actually, and that is where the research actually. And then, so we will have to develop a system where there have to be research fellows, there have to be softwares which will optimize all this time, where we develop a system where we don't miss data, we don't miss a live this thing, whereas the patients also are not missed, and doctor patient ratio also is actually
Maybe with technological
yeah.
advancements.
So
Yeah.
it's slightly a complex scenario where there is not one liner answer to that particular thing.
Right.
So it will take a couple of I think years to solve
Right.
that problem.
So, how challenging would you say studying medicine was for you? Because stereotypically, it's like,
Sorry, missed you.
oh, how challenging was studying medicine, like practicing, the entire process of being a medical student. How challenging was it? Because stereotypically, it's considered like very daunting, long hours, less time. So, how do you balance being social, being.
Yeah, actually, during medical school, 2 days medical education, and I was in medical school from 1985 to 89. And that time, the examination systems were slightly different than
Right.
what today's examination systems are there. So we had our 3 MBBS levels, first, second, third, and we had our exams after 1.5 years.
Okay.
We had ample time to enjoy as well as ample time to study, because exam used to be there university after 1.5 years.
Right. Right.
So typically when I entered medical school, first year always is from 12th standard going to medical school always is a bit of a cultural, you get a awe of it. You are now wearing a coat and going to a medical college and sort of things like that. And you get those big books. So, whatever you have studied till 10th standard, all the books put together, you have one book of 12th standard.
Okay.
All the 12 standard books put together, you have one book of your one subject of MBBS.
Okay.
Then all the books of first MBBS put together, your second MBBS
Right.
one book. It goes like that. And then all the books of your MBBS put together, you have only one book on knee surgery. So it's like that. So
Yeah.
you study one organ. So the study just goes on and on. But then you get used to it. You get used to it. You get used to your methods. I enjoyed. I was a 360-degree student like during that time. Some subjects I did not like, and so it was hard for me.
Yeah.
Typically subjects where you had to do a lot of mugging, and typically subjects which were logical, I used to like them.
Okay.
So
Physiology.
Huh?
Physiology.
Physiology was the best subject for me. I liked it. Physiology, I scored well. I had distinction in that. I was very favorite of physiology teachers, and anatomy also was good, but biochemistry I never liked. It was a subject where you had to do a lot of mugging and all those things. So it was not a very favorite subject for me.
So talking about studying methods, like there would probably be, I'm assuming, textbooks and maybe practical learning, right?
Yes.
But
First
nowadays,
year is like more of it's like not a huge difference between 12th standard and the first year of MBBS. It's the second year onwards, and you start clinical side. Then there's the difference. You start going and seeing the patient. That is where your methods start.
correct.
Mainly the group discussion starts. Then there are tutorials. Then there are clinical examinations. Group discussions. So that is where difference started. In our time, there were no computers or no presentations.
Yeah.
So we had to make those slides on transparent papers and then presentations on projectors and things like that. But that was one of the methods. So we had to do some presentations.
So in terms of study methods, so now if I take the contrast to like now, we have different methods of studying, like say from flashcards to like mugging up.
I saw my children this thing, and I really liked that. Means, when Tanmay, my elder son, was doing his, he's an ophthalmic surgeon. So he was studying his ophthalmic examination. He could see virtual surgeries and everything. I said, now they have great advantage now today. The methods are tremendously advanced today, and today's education is way advanced. I think compared to that time, we had very primitive sort of methods of education. But and they were mainly manual methods of teaching.
Right.
So we had to learn how to put a intracath directly on patient. So
okay.
we troubled the patient, but there was no other method available, no mannequins available, no
A
simulators,
lot of simulation.
no simulators were there. So so that was the method.
What
But we had a lot of cultural, and especially BZ Medical College of Pune is known for a lot of cultural activities also. So we had an art circle. I was a assistant general secretary of art circle of BZ Medical College. So we used to hold a lot of cultural programs. So we had cultural programs in BZ Medical College from Pandit Bhimsen Joshi. Then we had from organized by Hari Prasad Chaurasia, and then Pandit Ravi Shankar. So a lot of these stalwarts, they performed at BZ Medical College. Then Hema Malini, Nana Patekar, all these people used to come free of cost. Anuradha Podwal. So I remember so many. Kader Khan used to come. So all these people, Dilip Kumar Sairaval, they came. So I have photographs with all these celebrities that time, and they used to come to BZ Medical College, address the students. Then there were a lot of eminent doctors also used to come. So BZ is now more than 100 years old organization. The alumni is very strong. So these cultural activities was good. We used to host Cricket. So it was a all India medical tournament which used to be organized by BZ Medical College. So we were very active. We were very active in elections. So elections were very fiercely fought. So memories about it also.
Did you end up like probably playing cricket in?
Yeah. I was awarded the 2 consecutive as best batsman of the college. So I used to play decent cricket.
So chappal cricket helped you in actual cricket?
Chappal cricket helped me in tennis ball cricket also.
Okay.
And I used to tell, it was jokingly, even with chappal, they couldn't get me out. With the bat, how are you going to get me out? So with when Hema Malini was the chief guest, she awarded and Kader Khan. Both years I got a best batsman award that time. And 1 year I got best sportsman because that time I was university champion for tennis also.
So naturally a sport.
And I got award for in extempore drama also. So I was very good at extempore drama.
Okay.
So that was a competition where they used to give us a topic just
Right.
5 minutes before
Right.
that, and then used to do a drama. So Ferguson College that time used to hold a intercollegiate competition called InSync, I think, or something like that. And so BZ Medical College used to participate in that, and I used to play keyboard also. So I used to do a lot of things.
Yeah.
And so keyboard I used to play, and then in orchestra, and so we got second prize in orchestra and best prize in extempore drama. And the extempore drama we did was called Kala Pahad, means Black Mountain. And Kala Pahad was shown as a black dacoit. He was a dacoit.
Okay.
And the role of Kala Pahad was played by me.
Oh.
And that was the suspense. So by no way I look Pahad, and by no way I am Kala. So everybody was, that was the extempore drama. So nobody, and that suspense was maintained for 15 minutes, the time given to us. Who is Kala Pahad? And the Kala Pahad, ultimately the villain is me. And that is shown the end of the drama. And everybody, had a laugh of their life. So we did a lot of fun. But when exam came, we all medico study, and then there was a term called as night marne. That means you go to the library at say 4 o'clock, and then whole night you study. So we during exam season, you enjoy 6 months, 8 months, and after that, then the exam season comes. Yeah. And then everybody gets serious. Then there was a concept, something called in Marathi, that night marne. So everybody goes to the library after the lectures and clinics are over. They will go with a bunch of books and sit in the library, and then they will study throughout the night, and then go to the, it's very close to the Pune station. Right. There was a chai wala. So go to the chai wala after 2 hours, have a cup of tea, and then continue studying. So everybody has a fixed place and a fixed chair and fixed companions. So the most common companion, what I remember, not very fondly, were the bugs in the chair who used to bite us, like anything. Yeah. And they used to help us to remain awake also. So the bugs in a chair. So when you went to that time in library, first you bang the chair. Yeah. The bugs used to fall down to sit on the chair. So that's a lighter part. But when it used to come to studies, I think you need to really, really, really study very hard. I think medicine is the one of the toughest, if not the toughest course one has to undertake, and you have to really. There is no something called as curriculum as such. Correct. There is no textbook for medicine, and it is endless. The peculiar part is that if you are appearing for, say, MBBS examination, suppose you are appearing for surgery subject, then the examiner is a postgraduate. If you are appearing for masters, then the examiner is a super specialist. Right. So he is always having a superior experience and degree, and he is having 20 years practically more experience than you. And the scenarios can be different. Just like in law, there is no one solution to it. Yeah. So there is no one solution to one particular question. So exams can get very tricky. and so there is no one answer to one question.
So very subjective.
And that's why we say that in medicine and in law we practice.
Yeah.
Okay, you don't say that I do this. You say we practice.
Practice.
We practice medicine. We are still practicing it.
Right.
Okay, so there is no one answer to it. So you go on doing it, and so you learn from every case. No two cases are similar.
Yeah.
And this learning process doesn't end it with your degree or with your postgraduate degree. It is a ongoing process. It's a lifetime process, and this goes on. So every day, and you make it a habit of your life actually, which thanks to my postgraduate teachers who inculcated that habit in me, that don't sleep without reading one article, and still I maintain it. Whatever work I do all day, I don't sleep without. Now it has become very simple. On your mobile, you can read one article. So one article at least in a day you read and then sleep. So I have maintained it in last 33 years of my post MS career. I have maintained it, and my knowledge, I have kept it updated always, and I read it every day. You get time in your car. I have a driver, so whenever in car, you read it. So you know it's at your fingertips.
Yeah.
In mobile, you read it. So you have to keep yourself updated about medical knowledge, and the exam doesn't end there. So that habit you have to keep it.
So moving on to like your present segment, could you give us like how a day in your life looks from like the moment you wake up until your article before you sleep?
Yeah, actually, my wife calls me workaholic, and definitely, but I forget about work part of it. But typically, my day, I sleep for very limited time, and I have very less sleep. You can say it may be blessing, it may be curse also, but I typically sleep for maybe 4 or 5 hours. Sleep late. I am a very voracious reader. I got a library of more than maybe 2,000 books in my home, and I read a lot, and I read about everything. It's not only medicine. I've got from Adhyatma and philosophy, from fictions to everything, and I've got from Marathi to uh, everything. So I've got books of all variety, and I read a lot, and I love movies also. I see movies of all types. I love to sleep in movies.
Okay.
When I go to movies, generally, the latest movie I saw was that I shouldn't name it, otherwise people. So now you have got those beautiful recliners, and now they give blankets also.
Yeah.
And that movie was a 3D movie, and so they gave me a black goggle also. So with black goggle with a warm blanket, I slept, and I got up at the interval. So it was nice, and the movie started after interval. You might have. And my favorite hero appeared after interval.
Guess the movie.
Yeah, you might have guessed it. So I love movies and action thriller movies. So I see that. I love pets. I love them. So I have got 3 pets.
Okay.
I love dogs, and I'm a farmer by heart. I have a very beautiful farmhouse. I am doing my studies in agriculture. I'm doing my MBA in agriculture right now, distance studies. So I have a farm in Konkan where I'm growing medicinal plants and indigenous medicines. I'm studying that, and I'm taking guidance from one of the professors in Pune University.
Wow.
So there are a lot of Ayurvedic Indian plants which have got inherent medicinal properties.
Right.
So I'm studying presently that as my hobby, you can say. And I grow mangoes, I grow coconuts.
But where do you find the time to like study?
Oh, I think people who say there is I don't have time are lying. I have ample time, rather time for everything. A lot of time is there. So
So-
I get up early. That's the thing. Me and Mitali go for a walk at least 4 times in a week 4 5 times a week. We do pranayam quite regularly in morning. Our day starts at around 5:30. I get up at 4:30, quarter to 5, and then 5:30 we go for a walk, and then pranayam is there every day. Then after that, I come to the hospital around 7:15 and start my surgical work. And evening, if I find time, finish my day, then we walk home. My home is near from this hospital. From Nigri is far off, and so then in car I read, or then I do some of my official work sometimes, or sometimes I sleep in car. So I do multiple things in, and then we have some international OPDs. So I travel abroad for my African or Middle East OPDs also once in 2 months or something like that. Half an hour I make it a point to talk to my children every day. They also come and tell, because they are also busy, and they share their day. And every day we always take our dinner together, all three generations. We are talking, except for hospital. No hospital talks at home. It's always different subjects, mostly childish subjects, very light subjects. And most of the times we talk about Pandava, which is name of my dog, who is his name is Panda. He is a very chubby Labrador who is at my home, and my dogs at my farm are Bunty Bubbly. Bunty Bubbly are Kombai dogs, which are Indian breed, which I got from Salem, which is a very ancient breed, Indian breed, which was used in the war of Tipu Sultan, which is at the verge of extinction actually. And it's a very strong breed of Indian dogs, and so I got it, and now I'm trying to breed them. And they used to be traded for a price of one horse, Arabic horse, because their bite is so strong that they used to take out hamstring of one horse. So one horse they used to damage. So that's a very aggressive and very strong dog. So Bunty Bubbly are in my farm, and this Panda is here. So Panda became Pandava. So Pandava is very sweet dog. So most of the times it's we talk about Pandava, what he has done whole day. I think one more thing about our family, I would like to elaborate that we are quite in Marathi we say Adhyatmic family, something like that. We follow very religious family, and we follow Nrsimhawadi, which is Datta Deva Devasthan, and all of us in the family follow that. And I think that gives us a lot of mental, physical, and strength to fight, or whatever problems are there, or this thing, and keeps us stable. And nothing would have been possible without blessings of Lord Datta. I think that is most important, and we all believe that, right from children at home to my parents.
So, what one thing we learned about you was about your chai with Dr. Vaidya at Nana Nani Park.
Yeah.
So, if you could give us an experience of that, as well as so you've contributed to society a lot through our research, which we found, like your time at how you contributed during the Bhuj earthquake in 2001, as well as other African countries that you're working with now. So, do you have any special story of sorts that stood out to you, and have left integral change in your, or made you the person that you are now?
Yeah, I think Nana Nani Park and Chai with the senior citizens actually told me about their real problems, because we as doctors generally don't treat a person as such. Person is treated as a patient, and only we look at the knee or hip or that organ as such. But there are a lot of problems as a person when it goes, there are a lot of social problems or their personal problems, which we came to know when there were casual talks with these persons, which we came to know. So that was a brilliant idea, and we continue to do such activities till today also. You mentioned about my experience about Bhuj and Anjar. Actually, I started this Golden Hour project when the Pune Mumbai
express highway was being built, because that time there was a phenomenal increase in number of accident victims, because nobody knew how to drive a car on an express highway. And to tell you the number of accidents and who's who of Pune city across all the strata of society were getting admitted at Lokmanya Hospital with accidents. I mean, at one time, I tell you, there was, at that time I used to do a lot of trauma cases, accident cases, and I used to operate 30, 40 accident cases in a day. And so in a year, I used to operate around 8 to 9,000 accident cases. So then I wanted to go to the root of this, and I started what was called as trauma system, which was introduced for the first time in India, this trauma system. And this was to prevent the mortality and death on trauma. So in accidents, I name it as three peaks, the T1, T2, T3 concept. The T1, every day you open the newspaper, you will read a news about death in trauma and accidents. And recently in Pune, there was this accident. Now, see, yeah, exactly. So now this wouldn't have been prevented by any medical treatment. So this comes under the first peak, that is called as T1. So the death at on the spot, T1 is trauma at on the spot. When there is a run over your head, for example, no medical science can prevent it. So that is about 30% of accident deaths occur on the spot. Okay, so then the only way to prevent is just to educate the people about road safety. So I started going to the schools where the children are going to be license holders in near future, especially from 8 to 12 standard. And I educated about 2 lakh students in my vicinity. I was working in Pimpri Chinchod area, and in girls and boys schools. And I started educating direct accident pictures, mutilating injuries, bad injuries, no cartoons. If you don't follow the rules, this is what is going to happen to you: amputated legs, injuries, bad mangled limbs. That is what I showed them. I told them clear messages. If you are going with your parents, and if your daddy or your person has a glass of beer, tell them that I am not coming with you. You stop the car, I am going in an auto. If your parents, they break the signal, tell them that I am coming, getting down the car. I am not coming with you. Parents started coming to my OPD and started asking me, what have you told our children? They are asking us to stop the car, and we are getting out of it. The impact was huge. So this is to prevent even 30% deaths can be prevented by this, not by articles. Everybody reads in newspaper, sees those cartoons, nobody does anything. Second was to create a emergency medical system which will treat the patient on site, and the golden hour, the golden 60 minutes after the accident, you treat them. So I started this multiple patient carrier ambulances on the highway, which used to carry 4 to 6 accident victims, because in a car you have 4 or 5 people, and then one ambulance cannot treat it. So this system was created, and T3 was to create good critical care units which will prevent in hospital deaths. So this is a trauma system, and then rehabilitation. So this was a system which was created at Lokmanya Hospital, Nigdi, for the first time. So I started it on, I think, in December or something. And this earthquake happened in Anjar in Gujarat. Hardly after 1 month after this was launched. And I got the opportunity to employ the entire emergency system as it is. I picked up these ambulances, and one of the ambulances was convertible operation theater. So I took it to Anjar. I took it in the village. I took guidance of Indian Medical Council at Ahmedabad, and I asked them, where is the need? You tell me the village, and I adopt that village. So Anjar was suggested by them. So I went with 16 of my team members. We operated in 2 days. We did life-saving 86 surgeries. I operated day-night in 3 days. 86 operations we did in the ambulance, which was a convertible operation theater. And that was my one of the most satisfying experience as a doctor, because it's absolutely charitable. You don't earn money out of it, but right from children to elderly, we operated, did very major surgeries there in the ambulance. one hospital was there just nearby. Purnananda Hospital was there, and that hospital also was broken, half broken. And one surgery I required C-arm. It's a machine which is required for putting nails inside the bone. It's a X-ray machine, computerized. You must be knowing, but for common people, I am telling that. And for one surgery I required, so one girl was there, so I took her and me and my anesthetist, and we are operating. And you get those after quakes, after major earthquake, you get small earthquakes. So I was operating, and during that surgery, and there was a big crack in the operation theater wall. And during that surgery, earthquake, second quake wave came, and everybody, the ward boy, then the assistants, the nurse, then that father of that girl, the mother, everybody ran out of the hospital. Only that girl, myself, and the anesthetist, three of us were there. Fortunately, that did not collapse, and we completed the operation there. So that is also experience. So, but that was the most satisfying experience of my life. I think that is why we become doctors, to serve in such crisis, critical situations, and saving people on the highway. Definitely, I think thousands, lakhs of people, and that trauma and accidents. I call it a great equalizer. It doesn't differentiate between old and young. It doesn't differentiate between poor and rich. Everybody, all of us are equally susceptible to accidents, and most of the times it is innocents who die in accidents. And do you know, even in COVID also, during COVID years also, maximum deaths in India happened because of accidents, not because of COVID, not because of cancer, not because of AIDS. It is because of accidents we lost most people. And still the government doesn't pay much attention to these things. We have to pay attention to that.
So, we're seeing a lot of technological advancements in the medical industry, like going from VR to, like, I've heard about the concept of robotic surgery. Like, can you maybe explain about that?
Yeah, actually, I was the first surgeon to adopt robotic technology for knee replacement outside US,
Hmm.
and it was the first in India. I started it in 2016, and outside United States, it was the first center, Lokmanya Hospital, to start robotic knee replacement surgery in India.
Wow.
And till date, it is one of the highest series. We have crossed 14,000 robotic knee replacement surgeries, and it's one of the highest series in the world now. Not only robotics, I started with the lasers also, quite in spine surgery. Started with minimally invasive spine surgery. So I was always, hurt with when I was a medical student, when people used to say that India is 20 years behind UK in medicine, and आप लोग 20 साल पीछे हो. And I always, when I got gold medal in my medicine, my master's MS orthopedics, there was a newspaper interview when a reporter asked me, what is your aim in life? So I said that, see, I want to have British people to come to India for treatment, and I want British surgeons to come under me and take training.
Yeah.
And I want to tell them that India is advanced than Britain in medical treatment, and that is only possible with skills and technology.
Right.
And that was my aim in my career, and I think I have achieved it to a certain extent by bringing technology, because we got robotics before UK. We got numbers better than UK, and now we teach British people now how to do robotic surgeries.
Yeah.
And so I think definitely in our own way we are showing them the way.
Yeah. Achieved at a great extent, actually.
Yeah, definitely. So now, actually, after that, I'm very proud to say that India is becoming a hub of robotic surgery. Many surgeons in India followed our path. I have myself trained more than 100 surgeons across India who have adopted and followed my footsteps and gone for robotic surgery. And it is proving to be a great boon to our patients also, and to our country also, because lot of patients from all over the world are traveling to India for robotic surgery. So it's not only Narendra Vaidya, it's not only Lokmanya Hospital. But as a country, our country is getting prominence for robotic surgery, and patients from across the globe are coming for this particular thing. So I think that's a great achievement for myself as well as for the country.
All right. That's amazing.
Great.
So,
So we'll move on to the rapid fire round.
Yeah.
Basically, I'm going to be asking you quick questions and would expect immediate and quick, short
Okay.
responses. So the first one, stethoscope or scalpel?
Scalpel.
Favorite medical TV show?
Favorite medical TV show? Yeah. Good Doctor.
That's a nice one. Coffee or tea during long shifts?
Black coffee.
Favorite medical app or tool?
No.
Most common question from patients.
Will I be fine?
AI, boon or bane?
Boom.
Favorite part of being a doctor?
Happiness of patient.
Most used medical phrase?
Most used medical
Phrase.
Medical phrase.
Yes.
Well, I don't know.
First thing you do when you get home after a long shift?
After a long shift.
Yeah.
If I have worked hard, then I am happy actually, and I say thank you to God.
What's your biggest stress reliever?
Wow.
Who's your biggest inspiration in medicine?
Medicine. I think John Charnley, who was the inventor of joint replacement surgery, Sir John Charnley.
What's the one thing that you always carry with you?
Photograph of my family.
What's the hardest part of your job?
Hardest part, sometimes things don't work as per our plan, and things get complicated, and that time to explain the relatives is hardest part. A person who says that there are no complications, a doctor who says that there are no complications, is either lying or he has never done surgery. So there are going to be problems, and to explain them in a proper way is the hardest part of life.
And what's your favorite surgical instrument?
Favorite surgical instrument is my saw.
So surgeons are usually introverts, they say. Do you agree or disagree?
Disagree, and I entirely disagree. I am extremely extrovert.
Do you have a lucky surgical tool?
Not lucky, but I have some habits or some prejudice or some what do you say? Like I always put my left glove first.
Oh, right. Sachin wears his left.
Yeah, I'll always put my left glove first.
And the last question: the biggest advancement in orthopedic surgery?
I think technology, what we discussed, the robotics, the arthroscopies, etc.
Great. That was the end of the rapid fire and the podcast. We loved having you. Thank you for your great insights, and this was truly life changing for me as a individual as well. And learning certain habits like before sleep, always taking an article and other things like how you spoke about golden hour, which is like an idea which wouldn't have really come to my mind. And even the statistic that you said about during the COVID period, how accidents were the major cause of deaths. So thank you for your insights, and I'm sure our whole audience will be very inspired by everything they had to hear
Thank you.
through your
Thank you very
responses.
much. It was a great pleasure talking to you all. Thank you very much.
Thank you.